Hello, everyone, and welcome to today's industry webinar, Outside the Box, How to Financially Survive the Rural Market. My name is Alex Taylor. I'm the Marketing Manager of Health Insights here at Azalea Health, and will serve as your moderator for today's presentation. Before we get started, I'd like to go over a few items so you know how to participate in today's event. Everyone on this call is listening in using their computer audio system by default. If you would prefer to join over the phone, just select telephone in the audio pane on the right-hand side of your screen, and the dial-in information will be displayed. You will have the opportunity to submit questions by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the webinar. We will collect these and, time permitting, address them during the Q&A session at the end of today's presentation. Also, please note that Mark's slides will be shared in a follow-up email after this presentation in case you want to review again or share with any peers. I would now like to introduce Mark Renfro. As Executive Director of the HealtHIE Georgia, Mark's responsibilities include working with the network hospitals to identify funding sources, provide consulting and technical assistance to the network members, work with the network CIOs to develop a strategic plan, bylaws, assess the technology needs of the hospitals and the Georgia Southern research team to build a robust evaluation plan to measure and document the success of the network planning effort. Mr. Renfro also currently directs the Georgia HIT Regional Extension Center, ONC's Georgia Regional Extension Center outreach project with 56 hospitals participating. Under his direction, Mark has helped 90% of Georgia hospitals achieve meaningful use. We also have one of Mark's colleagues, Connie Alexander, joining us in the call today. As the administration financial analyst, Connie is responsible for the monthly financial close process and generation of accurate financial statements for the hospitals, clinics, and boards, as well as an annual preparation of operating and capital budgets, quarterly filing of payroll tax returns, annually filing of grant applications and surveys, annual preparation of Medicare cost reporting worksheets, monthly analysis of financial statements and statistical compilation. She serves as a liaison to independent auditors during quarterly financial audits and the hiring, training, and management of employees. With that, let me turn today's presentation over to you, Mark.
Thank you very much. Appreciate it, and looking forward to going over some of the programs we've been working with. Briefly, HealtHIE Georgia is a nonprofit here in the state of Georgia, and we do work outside the state of Georgia. My original projects began, believe it or not, in Kansas and Nebraska, worked up in Michigan, northern Michigan, mostly in the rural areas. But anyway, HealtHIE Georgia was put together back about 2014 to really service and to be a consortium for various hospitals here within the state of Georgia. And again, we are not restricted. We are working with some in Florida and others, some of the other states. But anyway, what we'd like to do today is go over the loan grant programs. I have Connie Alexander, who's our financial analyst, on the phone also. She is there to answer any of the questions that come up concerning, the financial feasibilities and the financial reports and everything else we have to do in preparation for these loans and grants. So with that beginning, I'd like to go ahead and move down to the next slide. And to begin with, what we're looking for is funding our community healthcare needs. With that, I've got one thing I got to do to just sort of minimize this side over here. Okay. And trying to get it out of my way. Okay, but anyway, what we'd like to talk about is grants. And one of the things that is very important is that you all, if you're going to look at grants, you need to go to www.grants.gov. We have worked with various grants out there, the State Office of Rural Health, HRSA, which is there. We've worked with National Institution of Health, NIH, and also ARC. These are the programs we've worked for grants. Grant programs are really interesting, and they're very difficult sometimes to get. They're highly competitive, and areas that you need to focus on. And also, we've been working quite a bit with the United States Department of Agriculture. And everybody says agriculture. Yes, the agriculture is really designed to support the rural communities. And what it does is it works on economic development. And one of the programs we look at is a rural economic development loan grant. That's called Red Leg. And with that, we'll talk about some of the case studies we've done with that, and also a community facility program, which is either a direct or guaranteed loan through the USDA. But all these programs are there for economic rural development. So anyway, we'll talk further about that shortly. And moving to the next slide. We'll go back to the grants.gov. There's pluses and minuses to this, and we'll talk about how you can go through and apply for. You can go out there. They even have a mobile app that you can track and go through and look for grants, send you little ticklers, notices when the grants are available to you. They're out from all different divisions of the federal government or state government, and it's tracked through this program. It does require you to make sure you go through and have a DUNS number, an FEIN number, also a grants login function, and so you get that set up, and then they can start tracking and working with you on that. One of the disadvantages we've talked about with the grants is the fact they are what we call a nickel. They basically get you into the program. It is highly competitive, and it really doesn't cover everything we need to do. And that's why we have also looked at USDA funding programs where we can get really the dollars we need to make a program work. And that's one of the biggest problems we've had with grants. They basically, again, highly competitive and also limited as far as the dollars we've got. We're working on one of them right now that requires 3 hospitals to participate, and it's for a 2-year program at $200,000 for the whole program. So when you divide that up over 2 years, $100,000 divided up by 3 hospitals, you're looking at $33,000 per year for the next 2 years on that. So it does limit the dollars you need to do for a lot of these projects. When we get into hospitals and the clinics and some of the medical office buildings we're talking, $1 million, $2 million, $3, $4, or $5 million that we need for equipment, for the building, for everything else. So we'll talk further about the loan program with the USDA. One of the things we're going to talk about is one of the opportunities you have as far as vision that you're looking at, and the behavioral health program that, oh gosh, I've been trying to reach this guy and just beeping in on me. So anyway, behavioral health programs, we're trying to really look at inpatient and outpatient programs that will benefit that community. And with that, a lot of the hospitals have to come up with a vision, what they're trying to do, what they're going to try and identify with that, what services it's going to provide. And as an example, we're looking at an adult senior care service program, and for the geriatric and patients. So with that, that's really trying to solve one of your priorities there. How do you fund this is one of the things we'll talk about shortly. Once that you have identified that you're going to focus on a behavioral health project, goals and expectations and outcomes are really important to what you need to do to identify what you're going to do. Focus on whether you're inpatient, outpatient, crisis medical stabilization, how are you going to get the patients engaged with the practices, how do you get the practices involved in the whole community network. And that's some of the things you can think about as you go through this comprehensive overview of that program. Planning and developing, of this integration for primary care is vital to being able to put this program together. We have proposed a bunch of these folks with 10-bed inpatient adult psychs. We have some intensive outpatient care facilities also we have worked on. And the plan should include ongoing partnership with, your various telepsych programs and other folks that you look at. But we've taken this from one of our settings and have worked with on that. So anyway, moving on. One of the other things we are looking to do is quite often the hospital really is built around survivability with having primary care physicians. They're closely aligned with the hospital. How do we add additional primary care physicians to that community to really be supportive of our patients is one of the other strategies we're looking at. How we turn around and work with some primary services. How do we go through the College of Medicine to provide third and fourth year residents in our area, hoping they will come down to how does the state subsidize, their college tuition and all their, medical costs that they had to go through going through school, and how do we partnership with these colleges of nursing and the hospitals to really enhance that stability that we need out there in the marketplace, in the rural market, and how we work with that. Also, we can talk about non-physician employees that needed to be added to the workforce. Why I'm here at this point in time, one of the things that's really important with the USDA is what is going to be the economic impact to that community. How are you going to improve that community? Are you going to be able to add jobs to that? And I jokingly say it's, three things they're looking for is jobs, jobs, and more jobs. The more jobs you can get on this program, the more they're excited about funding these opportunities. And that's really the primary area there. So adding primary care to that group is extremely viable. And one of the other things you want to think about with this is also, I'm going to go back up there, is adding even, a new clinic or a new building or a new medical office building or a medical service building that's going to provide other services there that you can expand out to. We're working with one of those programs up here in Hayesville, North Carolina, and we're going to be adding a medical office building. We have a primary clinic there that needs to be expanded, and we need other outpatient medical services to be part of that building that we're looking at. We're looking at about a $1.7 million project up there to really add physicians and add the facility and the equipment. So that's one of the things we're looking at with that program. Some of the other things that are vital to this area is cancer treatment options. How do we come up with a vision that we need to, present? How do we come up with the hospital strategy to work with and bring on some oncologists? We're looking for specialists. We just don't have specialists out there in the rural areas. One of the other things we have focused on, some grants, are called outreach programs, where the outreach is defined as I have got a cardiologist in a central area. How do I create, other areas where I can go and send that cardiologist or his, one of his PAs over there or medical assistants or nurse practitioners, and I actually open up an office in one of the surrounding communities, counties next door, one of the small hospitals, Critical Access, which only has a primary care doctor in their community. How do we add that specialist, cardiologist, oncologists, various other orthopedics? These are things that we can turn around and do. But again, we can look at the building, the unit, hiring the oncologist, bringing in the diagnostic equipment we need to, and setting up the whole program that needs to be put together for that particular service function. So the next one is cardiology, and I mentioned that briefly, but again, you can turn around and work with a hospital to set up a cath lab. We're working with Coffee Regional to set up a cath lab there and a cardiac rehab program there in Douglas to provide this. Here's the hospital strategy and what we're trying to accomplish, and try and build this project so we can complete and provide those services. And again, one of these things we want to do with this program is create an outreach to some of the other counties. We've got 3 or 4 counties surrounding us that we need to be able to provide services out there in that area for cardiology. So again, if you got any questions as we go through that, we'd love to sort of take those questions. So with that, one of the other things we're looking at is other funding opportunities. We have funded healthcare information technology, Azalea systems. We've funded hospital, CPSI systems. We also have talked about a medical office or a surgical center. We've actually worked, developed, and put together. The medical equipment. We've done everything from, lab to, radiology equipment. We've done Pyxis system for pharmacy distribution. We've done a lot of different types of medical equipment. There's call systems and everything else that you can think of can be funded and covered under these programs. Renovation. We've done a lot of renovation. One of the things I like to talk about quite often is the fact that we need to repurpose a lot of these small rural PPS type hospitals. They have space there that a couple of them we basically had been using as storage, and those rooms were nothing but storage areas. We've tried to turn them into productive, units where we can actually get revenue for having those buildings renovated to basically provide other things. Lots of things can be done with this renovation for outpatient services and really trying to build as much as you can. I worked with one hospital up in Washington, state of Washington, that is a critical access 25-bed hospital. Believe it or not, almost everything we did is new services, new stuff. We did a $110 million project up there, and I could not believe it at the time for critical access. But they had nursing homes, they had all the ambulatory outpatient services, they had a medical office, surgical center, and the hospital it was really just a 25-bed critical access hospital. The rest of it was really all these outpatient services that they've been doing. We can also do furnishings and fixtures, transportation, an ambulance, or a van can be put in the program, training and education. These are other opportunities you have for funding these programs. So we're going to talk about one of the programs called Red Leg. I put some red socks up there and not red legs, but anyway. What does this program do? It's basically a loan program that is provided through the USDA, and it is a 0% loan to local utility companies, which provides electricity to that community. We have worked quite a bit with a lot of these, what we call EMC. It's a electric membership co-op. We have a lot of those out here in the rural areas, where these EMCs are eligible to provide a zero-interest loan to that hospital, and they basically obtain the loan from the USDA, secure it, and provide it down to the ultimate recipient, the hospital, their clinic, for projects. And so they can turn around, and it can be up to as much as $2 million. So we can get that zero interest over 10 years. Think of the cash flow that you have by turn around and amortizing that over a program. We've used local banks to give us an interim construction loan, and then we've rolled it out into the zero interest program with the utility companies. We've used some of the cities some of the rural cities are eligible for this program. Who can apply? Basically, a rural nonprofit utility company is eligible to receive these Red Leg programs. They then can pass it on to anybody in the community. It could be a clinic, it could be a hospital, it could be actually a city development downtown renovation and redevelopment down there. These are some of the programs they can utilize that funding for. So, and the eligible areas, basically any place where the town is less than 50,000. A perfect example here is Habersham County up here in Georgia is basically a 64,000 people in the county, but the hospital resides in a town called Demarest. Demarest is only 1,495 people, therefore it qualifies because it's well below the 50,000 mark. So it is how you identified that. And again, like we talked about earlier, it's $2 million up to 0% interest during this whole program. No closing points, no cost, just amortize over 10 years, and you got 10 years to repay the program. So that is the Red Leg program, as I show you up here, the Red Sox. But the other program we're going to talk about is really a loan grant program. There's a small portion of it that's grant. I did one of them where we got $8.5 million in a loan, and we got $1 million grant. So we did 9.5 total, and we were able to fund healthcare information technology, radiology equipment, and really build a centralized network out in Kansas. That is one of the largest one. We went back again about 3 years later, 4 years later, and got another $5 million. So we ended up with about $15 million total on that project. Very successful, very interesting. And it was before all this meaningful use stuff. We did this back and started in 06 and got it wrapped up pretty much around 010 and 11. So we were eligible to meet the requirements for meaningful use. So we had systems in place, and we did it. It's a low-interest, long-term loan that you can get, and it really is designed to create and retain employment in that rural areas. If you're bringing in nurses, you're bringing in clinical staff, you're bringing in support personnel, that's adding jobs. And going back to one of the items we talked about earlier was really the Jerry Psych units. The Jerry Psych we have repurposed, renovated. We've turned around and added jobs. We've solved a problem we've had medically in the community with the opioid abuse, geriatric dementia problems, and then on top of it, it's a very profitable program. We've been able to basically add almost $750 to $1 million to the bottom line annually once the program's operational. These are what you can think about using these programs for. So with that, that's what we call CF, Community Facilities Program. It's a direct loan by the USDA, or it could be guaranteed by a bank, but any program. And again, you have to be a nonprofit rural organization. That's really the requirements for it. And with that, it's eligible. It's a lot of paperwork, as Connie can attest to that as we work through it, trying to get all the T's crossed, the I's dotted, and all the required paperwork necessary to do that. Who's eligible? Again, any project with a town under 50,000, and that is eligible for this program in the rural market. How much funding is available? $3 million within the state, but you can reach out. As I said, we've gone as high as $15 million in Kansas and $110 million out in the state of Washington. But for when those go, those are outside what are called the lending limits of the local state office. You will have to go through and work with the federal office in D.C. Very low interest rates, up to 7 to 40 years to repay, depending on the project, okay? And I'll go through a couple of them that we've done. One of them right here is really a funding source. Chautauqua Regional has a sister hospital over in Blairsville, which is called Union General. And it's located up in the beautiful North Georgia mountains in Hiawassee. I happen to live up this direction, so I love North Georgia mountains. Retired up here, did not know I would really fall in love with this area, but I have. So anyway, the vision that we were looking for is to provide a behavioral health care program for our community. We're existing up here in the mountains, a little bit isolated, got mountain passes to drive through, and logistics going to and from is difficult. What do we do with these patients? We've established a 10-patient inpatient clinic there. We also did exterior and interior renovations. You can see over on the right, the lobby, the redesign that we did for the lobby, and the exterior over here was completely redone. Did the The total project was $3 million. We did a $1.75 million of this through the USDA with 0% interest, financed over 10 years. Great program. The interesting thing on this project was the fact that we had done a community needs assessment. And one of the things the administration was very proud of is they had some of the best doctors, they had some of the best equipment, but the place looked like a 1950 motel. It really needed to be renovated. As you can see from these pictures, the renovation really turned this into a great mountain resort up there, it looks like, and it's just, and the people, the patients were excited about the new interior and exterior renovations. It really added value to that community. So that's one thought of how you can use those funds. Another one we did was the Emmanuel Medical Center down in, it's a 72 acute bed hospital down in Swainsboro, Georgia. And the vision was to create a behavioral health patient care program there also. We started with a 10-bed adult geri psych unit. And with that, the inpatient was added. We did some interior and exterior, nothing to what we did over there at Chautauqua Regional, but it was really exciting. We did renovated the lobby, new carpet, new furnishings and things like that. It really dressed up the place. But the important part about this is we had planned on our feasibility studies to go through and look at maybe with the 10 beds having 3 to 5 patients the first 9 months, and then growing it to maybe 5, evolving to 7. 8 was sort of capped at after 2.5 years, what we thought would be our average. Believe it or not, we were at 90% occupancy within 90 days. The state came back to us and said, you're doing so well on the occupancy. We would like to see if you would like to expand this unit from a 10 to a 15-bed unit. We did take that. We did additional renovations to make it a 15-bed, and we're still running it pretty above 80% occupancy. Again, it was one of those areas where we identified, we've added almost 15 to 18 jobs, repurposed some of the rooms that were used for basically for storage, and really started looking at the bottom line, very profitable, and also really solving a desperate need there in the marketplace that we needed to with the behavioral health issues. Some of the other projects, Jeff Davis is a new construction going on. Habersham, we did $3.25 million. We had a beautiful building. We had radiology and lab equipment that was well over 15 years old. It needed to be upgraded and replaced. Appling Health System, we did a little over, started off with $3 million. We ended up with $2 million on the project. New medical equipment, beds, furnishing, renovations, health information technology. Calhoun Liberty down in Florida, we did a new pharmacy Pyxis system and also health information technology. We've done a lot of other projects along the same line, but these are just giving you some examples of what we've been able to accomplish with this funding from the USDA. And that sort of sums it up right now. And I'd like to sort of open it up for any questions and turn it back over to the folks there at Azalea. Thank you again.
Thank you, Mark. We did have one question that I want to be sure we address before closing out today's call, and that's what's the best way to get in touch with you?
I was supposed to do that on the slide, and I forgot to do that. My email is marenfro@outlook.com. We will add that to the slide deck and make sure it's there. But it's we are located here in Georgia, and my number area code 706-782-0764. Again, it's M.A. Renfro, spelled R-E-N-F-R-O, @outlook.com. And I'll make sure we add that quickly to the slide deck and get that to you there. Okay? I'm sorry.
Perfect, Mark. Thanks. And along those same lines, I do want to note, of course, you can reach out to Azalea, and we are happy to connect you with Mark and Connie as well. So you have that as a backup option there, but to Mark's point, we'll make sure we get that contact information on the end of the slides. With that, we're approaching the top of our time, so I'm going to go ahead and conclude today's webinar. I do want to note that questions submitted that we did not have time to get to will be addressed following today's call. So thank you, Mark, and a special thank you for everyone taking the time to attend today's webinar, Outside the Box, How to Financially Survive the Rural Market. As a reminder, Mark's slides will be shared in a follow-up email, and we'll also include a link to review the recording of the webinar in case you want to review again or share with any of your peers. On behalf of Azalea Health and our presenter, thank you for joining us today and have a great rest of your day.